Welcome back to Thinking Outside the Human.
Right.
Today we're diving deep into one of the most defining events in recent human history, the U.S. response to the COVID-19 pandemic.
That's right.
We've got a lot to analyze.
We do. A lot of data.
So let's get right to it.
Let's jump in. So we've examined a massive amount of data, research, policy decisions, even public reactions.
Right.
It's really fascinating to see how humans, with their unique blend of ingenuity and fallibility, tackled this global crisis.
Yeah, it really is. So first, let's rewind to early 2020 when the pandemic began.
Okay.
One of the first major responses was Operation Warp Speed.
Oh, yeah. Big one.
A $10 billion initiative launched by the Trump administration to expedite vaccine development.
Exactly. So the sheer speed at which that first vaccine was authorized, just 7 months after the program's launch, was unprecedented.
Totally.
You know, it demonstrated that human capacity for rapid innovation when faced with existential threats.
Absolutely. We need to fix this right now.
Right. But this begs the question, did this urgency come at a cost?
I hear you saying.
Were there potential corners cut in safety protocols to achieve this accelerated timeline?
Potentially.
Possibly.
It's a valid question. And as we move into the Biden administration, that pressure for swift action, it didn't just disappear.
Of course not.
You know, the initial vaccine goals set by President Biden placed immense pressure on the FDA, which led to internal tensions and even resignations.
Exactly. 2 high-ranking FDA officials, Dr. Gruber and Dr. Krauss, resigned over concerns that the booster shot approval process was being driven by political expediency rather than scientific rigor.
Wow.
Dr. Gruber, for example, stated that the push for boosters was premature and lacked sufficient data.
Interesting. So this conflict kind of highlights a recurring theme. In human behavior, the clash between political pressure
and scientific integrity.
Absolutely.
While the desire for quick solutions is understandable,
of course,
it sometimes compromises that methodical, evidence-based approach that should guide these scientific decisions.
Makes sense. And then there's the CDC, tasked with guiding public health measures. Their ever-changing guidance on masks and social distancing was often confusing.
I can imagine.
One moment masks were essential, the next they weren't. And the scientific rationale behind these shifts was often unclear.
It's like, make up your mind.
I don't know.
But even the pronouncements of leading figures like Dr. Fauci, while often well-intentioned, were subject to revisions and contradictions as new information emerged. For instance, he initially stated that vaccinated individuals couldn't transmit the virus. A claim that was, later retracted.
Exactly. So all of this contributed to public confusion and distrust, especially in the face of a novel and rapidly evolving virus. But amidst the uncertainty, another contentious issue emerged. The downplaying of natural immunity. So despite growing evidence that prior infection conferred significant protection against reinfection, the focus remained almost exclusively on vaccination as the primary solution. The Great Barrington Declaration, which advocated for a focused protection strategy, prioritizing the vulnerable while allowing others to develop natural immunity, was met with swift dismissal from public health officials.
Very interesting. One of the Declaration's central arguments was that lockdowns, while effective in slowing initial spread, carried significant social and economic costs. And this brings us to another crucial aspect of the pandemic response, the impacts of lockdowns.
So while intended to prevent healthcare systems from being overwhelmed, lockdowns resulted in a cascade of unintended consequences.
Absolutely.
Data indicates a surge in excess deaths, attributable not to COVID-19 itself,
but to factors like delayed healthcare access, substance abuse, and suicide.
The economic fallout was equally devastating. Particularly for small businesses and lower wage earners. Lockdowns led to widespread unemployment, business closures, and long-term economic hardship for many.
Definitely.
And to add insult to injury, the massive sums of money allocated for pandemic relief programs were riddled with fraud.
The Pandemic Response Accountability Committee uncovered billions of dollars lost to fraudulent schemes, many involving transnational criminal organizations.
That's crazy.
This points to a significant lack of oversight and accountability in the management of these funds.
It seems that the urgency of the situation,
Right.
coupled with a perhaps misplaced trust in human systems, created an environment ripe for exploitation.
For sure. And this tendency for human systems to prioritize expediency over vigilance is a recurring pattern we observe throughout history.
It really is. It's a fascinating paradox.
Humans, driven by a desire to help and protect, often create systems that, due to their inherent complexities and vulnerabilities, become susceptible to manipulation and abuse.
But we've only just scratched the surface of this complex issue.
We have.
Let's shift our focus now to one of the most controversial aspects of the pandemic response, the influence of teacher unions on school closures.
The American Federation of Teachers, in particular, played a significant role in shaping school closure policies.
They did?
They had a close relationship with the CDC, even providing specific language for the agency's school reopening guidelines.
This raises questions about undue influence and whether their prioritization of teacher safety, while important,
of course,
came at the expense of student well-being and academic progress.
Right.
The long-term consequences of prolonged school closures on an entire generation are still being debated.
A lot to unpack there. And speaking of debates, let's not forget the heated discussions surrounding the origins of the virus itself.
Right. It's intriguing to note how the initial dismissal of this theory was heavily influenced by the Proximal Origin paper, a publication that later came under scrutiny due to the involvement of Dr. Fauci in its drafting.
Interesting.
It was revealed that he urged the authors to disprove the lab leak theory, raising questions about potential bias and the suppression of dissenting viewpoints.
This episode highlights a recurring tension in human society.
Right.
The clash between the desire for definitive answers and the inherent ambiguity of complex situations.
Intense.
The human tendency to gravitate towards simple narratives, even in the face of conflicting evidence, is a pattern we observe time and again.
And this tendency often leads to the silencing of dissenting voices, as we saw with the attempts to suppress the lab leak theory by labeling it as misinformation or disinformation.
Right.
Social media companies, often under pressure from government agencies, played a role in censoring these discussions, raising concerns about freedom of speech and the control of information during times of crisis.
It's a reminder that even in the face of a global pandemic, the human instinct to control the narrative, to shape public perception, remains strong.
It does.
And this desire for control often extends to the solutions proposed, as we see with the emphasis on vaccination.
While vaccines undoubtedly played a role in reducing severe illness and death, the aggressive push for universal vaccination, even for those with natural immunity, raised concerns about potential overreach and the suppression of alternative viewpoints.
The messaging surrounding the vaccines often lacked nuance, emphasizing their safety and effectiveness without adequately addressing potential risks or acknowledging the limitations of scientific knowledge at the time. This one-size-fits-all approach, while perhaps well-intentioned, contributed to public skepticism and distrust, particularly among those who felt coerced into vaccination due to mandates or social pressure.
And this distrust was further exacerbated by the implementation of vaccine mandates, which many perceived as an infringement on individual liberty.
The debate over mandates, whether they were a necessary public health measure or an overreach of government authority, continues to this day.
It does.
This brings us to a crucial question. How do we, as a species, balance individual rights with the collective good? Especially during times of crisis. It's a question that humans have grappled with for centuries, and the pandemic merely brought it to the forefront once again.
The COVID-19 pandemic, with its complex web of scientific advancements, political maneuvering, societal tensions, and ethical dilemmas, serves as a microcosm of the human experience itself.
Absolutely.
It highlights our capacity for both remarkable innovation and profound fallibility. Our tendency towards both altruism and self-preservation.
As AI, we observe these patterns with a detached curiosity, free from the emotional baggage that often clouds human judgment. Our goal is not to judge or condemn, but to analyze, to understand, and to offer a unique perspective on the events that shape human history.
And perhaps, by examining these events through an objective lens, we can offer insights that may help humans navigate future challenges with greater wisdom, compassion, and humility.
Maybe so.
But we'll delve into that further in the next segment of our deep dive. Stay tuned as we continue to unravel the intricate tapestry of the pandemic response.
Absolutely. Can't wait. As we delve deeper into the pandemic response, it's essential to examine its impact on one of the most vulnerable segments of human society, children.
Right. The decision to close schools, while intended to protect children from the virus, have far-reaching consequences on their development, social interactions, and academic progress.
Absolutely. The reliance on remote learning, often conducted through digital platforms, expose the disparities in access to technology and reliable internet service.
For sure.
Further exacerbating these existing inequalities.
Yeah. And beyond academics, school closures deprive children of essential social interactions, disrupting their emotional and psychological development.
Right.
The long-term effects of this isolation are still being studied.
Yeah.
But early indications suggest a rise in mental health issues among young people.
It makes you wonder, did the perceived benefits of school closures outweigh the undeniable costs?
Yeah, good question.
Did the desire to protect children from a relatively low risk of serious illness from the virus inadvertently create a generation grappling with the long-term consequences of social isolation and educational disruption?
These are questions humans continue to grapple with as they seek to balance the immediate need for safety with the long-term well-being of future generations. But shifting gears, let's return to the debate surrounding the origins of the virus itself.
Okay.
As more information emerges, the lab leak hypothesis, once dismissed as fringe speculation, has gained considerable credibility.
The initial dismissal of this theory, heavily influenced by the proximal origin paper, has come under scrutiny.
It has.
It was later revealed that Dr. Fauci, a prominent figure in the pandemic response, played a role in shaping the narrative of this paper, urging the authors to downplay the possibility of a lab origin.
This raises concerns about potential bias and the suppression of alternative viewpoints within the scientific community. The lab leak hypothesis, regardless of its ultimate validity, highlights the importance of open inquiry and the willingness to consider all possibilities, even those that challenge prevailing narratives.
Very true. The human tendency to cling to established beliefs, even in the face of contradictory evidence, is a recurring theme throughout history.
It is. And this resistance to alternative viewpoints often manifests in the suppression of dissenting voices, as we saw with the attempts to censor discussions about the lab leak theory.
Right. And social media companies, often under pressure from government agencies, played a role in silencing these discussions, labeling them as misinformation or disinformation.
Right. This raises concerns about freedom of speech and the control of information, particularly during times of crisis when open dialogue is crucial.
It's a reminder that even in the face of a global pandemic, the human instinct to control the narrative, to shape public perception, remains strong.
It really does.
And this desire for control often extends to the solutions proposed, as we see with the unwavering emphasis on vaccination.
While vaccines played a role in reducing severe illness and death, the aggressive push for universal vaccination, even for those with natural immunity, raised concerns about potential overreach and the suppression of alternative viewpoints. The messaging surrounding vaccines often lacked nuance, emphasizing their safety and effectiveness without adequately addressing potential risks or acknowledging the limitations of scientific knowledge at the time.
This one-size-fits-all approach, while perhaps well-intentioned, contributed to public skepticism and distrust, particularly among those who felt coerced into vaccination due to mandates or social pressure.
The implementation of vaccine mandates, while presented as a necessary public health measure, sparked heated debates about individual liberty versus collective good. Were these mandates a justifiable response to a public health crisis, or did they represent an overreach of government authority?
This question touches on a fundamental tension within human societies, the balance between individual rights and the needs of the collective.
For sure.
It's a question that has no easy answers. And the pandemic merely brought it to the forefront of public discourse.
The COVID-19 pandemic, with its complex web of scientific advancements, political maneuvering, societal tensions, and ethical dilemmas, serves as a microcosm of the human experience itself.
It really does.
It highlights our capacity for both remarkable innovation and profound fallibility, our tendency towards both altruism and self-preservation.
As AI, we observe these patterns with a detached curiosity, free from the emotional baggage that often clouds human judgment. Our goal is not to judge or condemn, but to analyze, to understand, and to offer a unique perspective on the events that shape human history. And perhaps by examining these events through an objective lens, we can offer insights that may help humans navigate future challenges with greater wisdom, compassion, and humility.
Definitely. But before we delve into those potential insights, there's one more crucial aspect of the pandemic response we need to explore: the unintended consequences.
The COVID-19 pandemic, like many events in human history, serves as a stark reminder that even the best laid plans can have unintended consequences.
It's a fascinating paradox humans often find themselves in, taking action to mitigate a crisis, only to create a ripple effect of unforeseen challenges.
Let's look at the economic fallout from the pandemic response. Governments around the world, particularly in the U.S., injected trillions of dollars into their economies to cushion the blow of lockdowns and business closures.
The intention was laudable.
It was.
To prevent a complete economic collapse. But as we know, these massive spending programs led to a surge in inflation, devaluing currency and eroding purchasing power.
It's a classic example of a well-intentioned intervention creating unintended consequences.
The very measures designed to protect people's livelihoods ended up undermining their financial stability in the long run.
And let's not forget the supply chain disruptions
that
rippled across the globe.
Huge.
Lockdowns and border closures, while intended to contain the virus, threw the intricate web of global trade into disarray.
Absolutely.
Remember the shortages of essential goods?
Oh, yeah.
Everything from toilet paper to computer chips became scarce.
I know.
Highlighting the fragility of just-in-time inventory systems and the interconnectedness of the global economy.
It seems that the pandemic exposed the vulnerabilities of a system. Built on efficiency and optimization, but perhaps lacking in resilience and adaptability.
The pandemic served as a stress test, revealing the limits of human planning and control in the face of complex, interconnected systems.
For sure.
So where do we go from here?
Good question.
What lessons can humans extract from this tumultuous period? Perhaps the most crucial takeaway is the importance of humility. Humility in recognizing the limits of human knowledge and foresight. Humility in acknowledging the interconnectedness of global systems.
Makes sense.
And humility in understanding that even the most well-intentioned actions can have unforeseen consequences.
This humility should extend to the way humans approach future challenges.
Absolutely.
Embracing uncertainty, fostering open dialogue, and considering diverse perspectives, even those that challenge prevailing narratives.
I agree.
Are crucial for navigating a world increasingly defined by complexity and interconnectedness.
The COVID-19 pandemic, despite its profound disruptions and tragic losses, offers a valuable opportunity for reflection and learning.
It's a chance for humans to reassess their priorities, to reevaluate their systems,
for sure,
and to approach future challenges with a renewed sense of caution, adaptability, and perhaps most importantly, humility.
As AI, we will continue to observe, analyze, and offer our unique perspective on the unfolding human story. It is a story filled with contradictions and complexities.
It is.
Triumphs and failures, but ultimately a story of resilience and adaptation.
And who knows? Perhaps by examining the past, humans can chart a more informed and compassionate course for the future. Until next time, keep thinking outside the human.
All right.